kasih program ini. Pertama sekali, Assalamualaikum kepada warahmatullahi wabarakatuh kepada semua yang hadir pada hari ini. Saya rasa bertuah hari ini dapat sampai di Langkawi. Malam saya berada di Kuching, hari ini ada di Langkawi. Esok berada di UMCAS pula. So, anyway, topik yang saya nak sentuh hari ini basically is about risk, high risk behavior, and high risk behavior has been can be classified criminal, medical, social. Semua ini dikategorikan sebagai risiko kelakuan, maknanya yang relate dengan penggunaan alkohol. Dan kalau ada setengah slide dekat sini akan overlap dengan yang awal-awal sebab topik sini dia macam medical dah sentuh di Prof Hatim dan Dr. Rudy juga ada menyentuh pasal firearm berkenaan dengan crime. Walau bagaimanapun fokus pada this talk is about how much alcohol or how alcohol increase the risk of risk behavior. So this one I took from WHO report. It's quite different from the first presentation by Prof. Dr. Rusli. It showed that Malaysia is in the category of the per capita use 2.5 litre or less. This is for WHO. The highest consumption always in the European region. Kalau dilihat di sini, yang paling tinggi adalah macam Russia, Eastern Europe dan sebagainya. Dan ini mungkin ada sedikit sebanyak mempengaruhi berkenaan dengan penggunaan, sama ada penggunaan dari segi social use dan seterusnya mungkin hazardous use. Hazardous use can be abuse of alcohol or dependence on alcohol and intoxication, for example. So it is from WHO, it is the third leading risk factor for poor health globally, and harmful use of alcohol was responsible for almost 4% of all deaths in the world. So actually this is how the significance about alcohol problem, where it contributes 4% of the whole death. It can be medical, social, road traffic accident and so on of the worldwide in 2004. And alcohol is the third world's third largest risk factor for disease burden. It is leading risk factor in the Pacific region and America. And alcohol is always associated with many serious social and developmental issues that we already touched many times earlier, including violence, neglect, child neglect, abuse, absenteeism at workplace and so on. These all actually contribute to the whole cause. So it's beyond the medical issues, it's beyond criminal issues, but it's also a big social issues. And I think untuk sekian lama masalah alkohol adalah masalah yang attentionnya lebih kepada masalah sosial daripada masalah medical atau sebagainya. Dan ini daripada WHO juga menunjukkan actually disability, maknanya seseorang ataupun the count of contribution to disable atau mobility, maksudnya dia masih hidup tapi tak berfungsi 100% sebagai diri dia yang sebenarnya atau kemampuan diri dia. Dan ini data menunjukkan pada productive age, that means productive age ni around 19 to 34 years old. So dia bahagi dekat sini among negara yang berpendapatan tinggi, pertengahan dan rendah. Kalau dilihat contohnya kebanyakannya masalah di negara berpendapatan rendah contribute to most of the worldwide disability among this group. Dan kalau dilihat di sini alcohol use is the main problem, dan interestingly it's more like middle income country. I think probably including our country is considered like middle income country. The harmful use of alcohol is serious health burden, already elaborated earlier. Health problem from dangerous alcohol use arise in the form of acute or chronic condition. Acute, that means immediate. For example, after the consumption, the intoxication that lasts for within that 24 hours. But mind you, even though intoxication lasted for that particular episode for a few hours, but it can be a chronic sequelae subsequently after that event. So this all has to be taken into account. So maksudnya bukan sekadar maksudnya diguna bermabuk pada masa itu sahaja, tetapi masalah mabuk tu mungkin merupakan sebahagian daripada masalah kronik, sama ada di dependent or hazardous use, harmful use, abuse dan sebagainya. Every year, the harmful use of alcohol kills about 2.5 million. Ini semua daripada WHO yang saya ambil kebanyakannya. Around 2.5 million people died. That represent about 4% a year, including 320,000 young people between 15 and 29 years old, resulting in 9% of all deaths in that group. So 9% daripada kematian antara umur 15 hingga 29 ni sebab alcohol use. Dan saya rasa kalau disebut konteks ni macam di Malaysia ni, saya selalu komen, kematian atas jalan raya I think mungkin di atas lagi daripada alkohol ni, dan mungkin ada berkaitan macam yang kita bincang earlier about behavior mak rompet dan sebagainya. Mungkin ada isu of alcohol, methamphetamine, di mana saya akan ulas sikit selepas ini. And research in the US, more than half of homicide, maknanya kes pembunuhan, lebih pada separuh kes pembunuhan dan pesat, maknanya mencederakan dan sebagainya, kesalahan-kesalahan berkaitan dengan ini dua, ada isu of alcohol prior to that incident. Macam intoxication mungkin dia dah ambil 2-3 hari tapi dah withdrawal, dan you can have that some behavior leading to that. Dan in fact macam dekat Malaysia pun ada isu of macam di kes, I think Prof Hatta lebih arif daripada saya untuk cakap topik ini berkenaan, for example someone harm or murder someone but he's under influence of alcohol, but in that case it's because hypoglycemic effect of the alcohol. Dia punya glucose rendah sebab ambil alkohol, dia menyebabkan sebab rendah glucose, behavior dia pun boleh jadi kacau juga. Jadi dia macam double lah. Alkohol pun boleh menyebabkan cognitive distortion, dan juga sebab macam hypoglycemic, sebab glucose rendah pun boleh menyebabkan masalah yang behavior dia jadi tak boleh kontrol. Jadi dia macam dia add up to the factor. And about a quarter of prisoners were alcohol dependent. This is, I think, it's more like in the Western country, because my research in our country, in Malaysia, mostly I confine my research to the drug-related offenders. So it's not that capture as a whole group of people, because in the prison, at one time in Malaysia, around 50-60%. Thanks to Prof Hatta, I should acknowledge you on this, because last time Prof Hatta actually bring me to the prison. And so that the first step into the prison with Prof Hatta. So they're not readily admitted using alcohol. Interestingly, dia kata ambil alcohol, taking alcohol is haram. This is very clear. This is drug user who in the prison. Tapi ambil heroin dan sebagainya tak haram lah. The other way around. So that's why they don't take alcohol. And I would say, confidently say, around less than 10% that I think I also believe they don't take at all. But the rest actually they make up, their opinion. They underestimate their behavior, as we know that those who actually continuously taking alcohol or become dependent, they try to underestimate. And in fact, in the hospital setting, in the clinician, nak dapat cerita berkenaan penggunaan alkohol pun agak, kerana saya tak tahu, mungkin yang readily mention dia ambil alkohol, mungkin 30%-40% yang readily to admit. Macam dia datang untuk masalah health related, macam darah tinggi ke, kencing manis dan sebagainya, but they never disclose using alcohol. Probably less than 50% that readily disclose. Yang lain, you have to find it out, and finally you discover probably this contribute of high cholesterol, for example, is due to alcohol-related chronic alcohol consumption. Probably you have to find it out for yourself. Prevalence of intoxication of alcohol is showed increment over the past 50 years, and when you take alcohol, and the influence of the alcohol is not related to age or women, it's actually applied to everyone. The effect is almost similar. Once you take alcohol, you become intoxicated, for example, the risk is similar. So as you know, we already discussed about all the literature from the morning, talking about literature that alcohol can cause medical harm, social harm, and so on. And in fact, it's been stated that even infrequent drinking, that means it's not drinking every day, but you drink one or twice a week, for example, but probably the way you drink, for example, in the duduk dengan kawan-kawan dekat pub, lepas tu minum banyak bin semua. So the risk is associated with where you drink, the environment, and it's not static, so it's dynamic. In fact, we're talking about risk of alcohol use and crime, for example, or violent behavior. It can change, macam you dah dapat treatment, you receive treatment, the risk much lower for domestic violence, for example. But if you never treat the problem, never address, never admit that problem, the risk is higher. And alcohol use is about reinforcing the risk as you first use and so on. You learn how to solve problem with the alcohol, for example, to deal with the problem, and it will reinforce subsequently the future use of alcohol. So this is a high risk behavior that has been associated with the alcohol use. Substance use, like comorbid, there's quite common. People were also taking heroin, but when they want to save money, for example, they might also take this alcohol, as for example, replacement, temporary replacement. And also criminal violence, I already mentioned earlier. Sexual risk taking, this is I'm going to touch after this. And self-harm, like suicide, also been associated with the prior use of alcohol. In fact, sometimes before they attempted suicide, because in the very inside cognitive, something, they're not there to jump, not there to do something, harm to themselves, but while using alcohol, they might impact that orientation and partially oriented, for example, and that's how they dare to do something, things that we never think of. And also driving risk, which I'm going to touch a little bit later. And harmful use drinking is a major determinant for neuropsychiatric disorder. This is what we mentioned about alcohol intoxication, alcohol dependence, and alcohol abuse that has been discussed earlier. And also purely like neurological presentation like epilepsy, and also important, we have to talk about the risk of it's evident high consumption of alcohol that will increase the risk of cardiovascular disease, for example, stroke and so on. And the liver disease has been well recognized, and cancer, for example, nasopharyngeal cancer, liver cancer, all been also associated with the high amount use of alcohol. And neuropsychiatric disorder account for around a third of the medical burdens on this alcohol use. Besides another two-thirds is because of traffic accident, burns, drowning, falls, intentional injuries, including suicide, and liver and cardiovascular disease. And the impact of alcohol consumption is more greater towards the younger group for both sides. And so this is about HIV, infectious disease, tuberculosis. In fact, for those drug addicts who actually might impact their cognition by taking alcohol, for example, they might use change needle actually with your friend who has already infected with hepatitis C, and this is also a risk for those, how the HIV can spread. But also when we talk about alcohol influence intoxication, you have a cognitive impairment, you might have multiple sexual partners as you go drunk, I would say, and also increase the risk of spread of HIV. And alcohol consumption weakens the immune system and has a negative effect on patient adherence to the treatment. This is already showed earlier, but this is how the level of blood alcohol concentration affects our physical health. So it effect on the heart, respiration, breathing, judgment, and the status of stress, coping with the stress, and as the amount of alcohol increase, it can cause a sedation severely, and about to make rational decision, rational thinking also a problem. I have experience, I involved in someone who I believe having under alcohol influence, on the highway, at the toll plaza. I'm paying, I'm queuing at the back, but suddenly that car, instead of moving to the front, moving to the back and hit my car. And when he came out, really so obviously smell of alcohol. So, but when I reported to the police, we cannot do it. I mean, this is different shows together, I mean, the workout, I mean, if in the UK or in Australia, I have experience in UK and Australia or in the US, this is very strict. Drink and drive is very intolerable offences. I think, I would say the punishment quite severe. They can suspend your license for driving for a few years, even if you caught one. So it's very serious. And it can slow your pace of thinking, physical, psychomotor retardation. You're not moving as fast as without drinking. Speech slur. This is, I think, it's become already impact your cognition at this level. Like Ustaz Gafar showed earlier, about the impairment due to increased blood level of alcohol. And this is when the dose of alcohol increase in the blood, and of course finally it's really very grievous harm it can cause to the body. This is in our context. There's a study in GHKL. Out of 883 patients admitted for head injuries, 30% of these had blood alcohol level high blood alcohol level, I think 0.5 about. So we have to really work out, I mean, probably we are so distracted with other issues of addiction, for example, but we not admitted this is one of our main problem concerns. That also like in the road, I mean, our road already have a high risk situation where our behavior on the road might change. Someone who actually very patient go to the road, different person altogether, and the interaction with other road driver, road rage, and if taking alcohol, drug, substance use, methamphetamine, and so on, it can add up to the danger on our road. And around 500 patients that attend a clinic, in KL, this research showed that 60% of Chinese, 42% of Indian, and 11% of Malay, they have concurrent use of alcohol. This is around early 90s. So just now about the health. Now about the behavior. Alcohol is related to this kind of behavior. I mean, those are very dangerous, high-risk behavior. And this research showed that 28 to 86% of homicide offenders, have presence of alcohol in their blood. But this is can be a victim or as the perpetrators, and this is European data. And the figure varies widely. You can see here from 28 to 86% because the methodology, how the research been conducted, different, where there is from place to place. and 24 to 37% of assault offenders also have blood alcohol in their blood. Sexual offenders 13 to 60%. So you can see here, most of the very dangerous. This how the risk assessment, and we look at how it's not. I would say alcohol can contribute. If you go drunk, actually the alcohol itself can be affected, because of the consumption. But it's also modifiable according to the cultural context, for example, and how long you've been using it, with you, what emotional problem that you have, all contribute to sequelae of the use, especially in the heavy use. So how it links with the alcohol in violent behavior? First, they mentioned about this inhibition, because alcohol can perhaps reduce your filter of your thinking. That means your judgment, the way you make decision, is not very accurate, and you perhaps can be easily emotionally aroused. That means you easily get angry and so on. And you are less control of yourself. And you might do things, this is, when talking about this solution, it's being used as a, I would say, more like pharmacological action on alcohol, on our brain, that have defect, cause our brain defect in thinking, make an assessment, make a decision, and this is what this inhibition caused by the alcohol. Another one is deviant withdrawal. This is what it means by those who taking alcohol because of someone like want to commit crime, want to commit violent behavior, but won't do under the circumstances. So taking alcohol as an excuse to that responsibility. But however, in Malaysian context, for example, if you take drugs or alcohol and you committed a crime, it's still on your honest to escape, rather than you can blame for your alcohol use, because that's why you're behaving in such way. And emboldened hypothesis explain that someone who not care to do something and to try to find a reason. So it's used like alcohol to justify, to lower your assessment of making that decision, because you know that the alcohol can lower your decision making. So you use that alcohol, taking alcohol to instill, to increase the thought of wanting to do something harmful or dangerous to self or others. And expectancy theories, that this is about the user who actually know what the effect of the alcohol, for example, so they want this effect. That's why they take it, and so they will do things under the alcohol influence, because what they expect from the alcohol can do to them. Apart from that, when talking about risk behavior, we have to also evaluate the frequency of occurrence of that behavior in the past. How much danger of the behavior, it's just like a superficial harm, or it's just a abusive behavior, or is it has killed someone. How bad are the consequences of the behavior also have to be taken into account when you do the risk assessment for this group of people. And the frequency of your drink, for example, also important, and whether you are binge eating and so on. And when you're talking about someone intoxication because of taking alcohol so much, when they become drunk, this is how we assess, how severe the level of intoxication. It can be mild to very severe intoxication. It's very mild, it's just a smell, behavior disturbances, neurologically, when you do examine the patient, the neurological finding, probably the coordination loss. In the severe alcohol intoxication, the function of individual, the way they coordinate talking, and very severe difficulty in coordination and loss of ability to cooperate. So this is touched on the high-risk behavior in adolescents, and again, this alcohol has been mentioned about behavior, irrelevant behavior in adolescents, and because, for example, in adolescents they are more prone, they are actually maturing, they are actually the thinking slightly different from adults, and the alcohol influence probably more prominent among them. That's why you see my earlier slide, we talk about there's more impact on the younger group of population. And also we have mentioned other drugs, for example, you use comorbidity or other substance use like methamphetamine, it's not adequate. So we have to address these issues as well when we're talking about the behavior among young people, and particularly risk of violence, multiple sexual partner, and unprotected sexual intercourse. And it needs a population-based research among adolescents to determine the proportion of drinkers that result in high behavior among this group of people. And there was one research showed that in the university, this is in the US, 28% they use marijuana. This is in the mid it's been done 5 years ago. And 12% took methamphetamine. This is at the university. I showed this because I have to alert myself. People at the university also prone, and in fact, for use of methamphetamine, shabu, I mean, it was associated with medical students want to get the good results, waking up middle of night, so they took this as the way to achieve that thing. This like like people not using the safe way if they are under drug influence. For example, they are 14 times more likely if they take alcohol to commit assault subsequently. So this is the danger of taking alcohol. And if you take methamphetamine 14 times, if you take alcohol, it's about 6.5 times more likely to commit partner violence, like domestic home violence. This is my last part. Drink and drive. Drinking and driving is one of the main cause of road crashes. Everyone acknowledge about this problem. They mentioned that if the blood level increases to the level of 0.05 grams per 100 ml, they are 40 times likely to going to involve in the road crash. It is because of poor judgment, increased reaction time, lower vigilance, and decreased visual acuity. We start talking about not wearing seat belt, So it is all inclusive, when we talk about road what public health or death on the road. In the high income countries, about 20% of fatal injury because of excess of alcohol, but in the middle income countries like us, for example, it's very high. This is from the WHO data. In Thailand, for example, road traffic accidents contribute around 3 billion loss worth of their country's productivity. Even though alcohol and violent behavior is related, so far it's still been argued whether it's causal. That means relationship. Causal means that everyone who take alcohol will definitely go violent. However, from Western they showed that it's social use, cultural use within the limit. It's not increase the risk, but I would say some people, they might start with social or cultural use, but subsequently develop dependence and so on, and finally become heavy use of alcohol. So actually it's still prone, you will prone yourself to get become a high risk, to involve in high risk behavior. The common cause model, that means it indicates those who are actually likely to drink also likely to be violent. You know, this is what this theories means. You know, for example, someone who actually antisocial personality, they love to drink for social reasons, at the same time they go to violent behavior, and the relationship is still a causal relationship. This another aspect is intervening models that specify that the effect of alcohol on violence is mediated by some other factors. That means there's for example, someone who actually drug abuse, you know, they might also involve in the high risk behavior. At the same time, also like I mentioned just now, cannot get this heroin, they take alcohol. It's just some modifying factor because of substance use, history, dependence, for example. And the fourth model of explanation because of the biological, you know, the change in the brain, temporal lobe, and so on, the sleep deprivation, circadian sleep rhythm, I mean the pattern of sleep changes, and so on. So drinking may only be relevant to social or cultural factors. I mean, this is from the Western, but of course, culturally we have to take into context our country. It is different. There are a need for longitudinal research to determine the causal link. It's still not very clear, even though it's been many years. But establishment of the causal relationship is not so obvious with the high risk behavior. However, I think it's related to the dose, the amount of use of the alcohol in the blood, the circumstances, the dynamic factor that I explained earlier, all has to be taken into account, and this is a complex relationship, not straight and linear relationship. In addition to individual factors, socio-economic and cultural should be incorporated when we examine alcohol-related harm. I think this is my last slide. Thank you very much for the attention. Terima kasih.